Hi, and thanks everyone for joining us today, and welcome to the latest in the CalHIPSO educational webinar series. I'm David Ford, the Executive Director of CalHIPSO, and I will be just running through a few quick introductory slides, and then we will be passing to our faculty for today. So let's go to the next slide. So today's webinar is titled Using Health IT to Reduce Compliance Risks, which is obviously a very important and interesting topic, and I'm hoping we'll all learn a lot about reducing compliance risks today during this next hour during our lunch break. Just very briefly, because we get a lot of people on these webinars who are not familiar with CalHIPSO. So just in case you come to us through some other channel and you're not familiar with CalHIPSO, we're a nonprofit entity that was founded in 2010 by a joint effort of CPCA, CMA, and CAPH. We were the largest of the 62 federally designated regional extension centers by the number of providers served. And for most of our time in existence, our world has really been about helping providers with electronic health record adoption and achieving meaningful use. As time has gone on, though, CalHIPSO is branching out into many different areas. So just with current or upcoming projects that we work on, we are still doing some work in meaningful use, specifically on the Medicaid, or here in California, Medi-Cal side, under the California Technical Assistance Program. We've been doing some work down in Southern California around encounter data submission. And as you may have seen, we are just launching this year a project to help small practices and other safety net providers to form into accountable care organization, with CalHIPSO acting as the practice transformation support services for those efforts. To date, across all of our programs, CalHIPSO has provided technical assistance to over 13,000 clinicians, and we've helped clinicians access a little more than $300 million in federal incentive dollars. So today, we are pleased to be joined by our partners and friends with HIPAA Watchdog, which is a function of E2O Health, who have been longtime supporters and friends of CalHIPSO. And so at the moment, I believe we are going to start with Kelly Carter as the first presenter. So we will go on mute. We'll pass it over to you. Take it away.
Thank you so much, David. I appreciate your introduction, and we're so grateful to be presenting here today. And we will be discussing, let me make sure I have control here. So we'll be discussing health IT compliance and utilizing tools to go ahead and implement a compliance program to be active in our health centers. And we'll start with talking about, why do we need a compliance program? We know that a compliance program really should be our first line of defense against the government investigation in health centers. And while CMS and the OIG have long recommended a voluntary compliance program to help avoid, erroneous claims and fraud within our health centers, the introduction of the Affordable Care Act in 2010 makes it almost mandatory for us to have compliance programs based on the approval from the Secretary of the Department of Health and Human Services. So we see that not only in the past has it been recommended, now it's starting to become more mandatory. And in 2016, we saw with the CMS overpayment rule, now it's saying that if we don't have a compliance program, it's a failure to exercise reasonable diligence and is in fact a violation of the False Claims Act. So we're seeing that health centers that are audited by CMS and don't have a compliance program are now in violation, in fact, of the False Claims Act. And in the FQHC world and lookalikes, we have long since been required to adhere to HRSA requirements and FTCA requirements and have a formal compliance program. So we see now, regardless of what type of health center or practice that we have, medical practice that we have, we are required by many sources to address compliance in various ways. So we see that, a lot of health centers do go ahead and address compliance in many different ways, some by, sticking their head in the sand and ignoring the regulations and only really reacting when they are audited or that they are receiving a fine, and they're just reacting to the fines and audits coming upon them rather than proactively implementing a compliance program that can help them, reduce risk, manage their risk, and be more proactive. So let's talk a little bit about what some of the fundamental elements of an effective compliance program are. What does that in fact look like in our organizations? Now, an effective compliance program would have hallmarks of a written policy and procedure in regards to specific regulations. It would have a designated compliance officer, and in larger healthcare organizations or health centers where you have large infrastructure, different departments, you'll probably will also have a compliance committee identified for your compliance officer to have support to run policies and procedures by for approval. Also, it's very important to have an effective training and education program to inform our staff of what regulations are required of our health centers and what role they have in adhering and complying to those regulations. We also want to develop effective lines of communication so everybody's well informed and knowledgeable of what their roles are, and also what stands to be at risk if we don't adhere to our compliance regulations. It's important to conduct internal monitoring and auditing through risk assessments and have a structured program for monitoring the policies, procedures, and activities that we're conducting. And then to go ahead and enforce the standards through disciplinary guidelines. And almost all of the regulations require us to document offenses that were detected and go ahead and document a corrective action plan. So those are the 7 elements of an effective compliance program and what it really should look like if we had an effective compliance program put together in our health centers. Now, what are the goals of compliance overall? How would that impact us? We realize that in a high-performing health center, that looks more like using compliance opportunities in a continuous process to improve performance and strive for operational excellence. I know a lot of people are, like we said, we see a lot of health centers that are just responding to regulations, fines, and audits, and are not utilizing this opportunity to really take control of compliance, to utilize it to improve performance and operational excellence. And that's what we're going to try and equip you with today, is tools to actually strive for that higher goal of operational excellence. So our objectives of learning about compliance today are as follows. Our presenters will help us identify, each one of our presenters will identify what compliance requirements are required of each type of healthcare organization, FQHCs and private medical offices. We're going to talk about the opportunity to use that compliance requirement to improve performance and operational efficiency, and we'll identify and equip attendees with a plan and tools necessary to adhere to each one of these regulations. Just a quick covering of the topics today. We will be talking about the following requirements. We'll talk about navigating the fraud, waste, and abuse laws from the Office of the Inspector General. We will talk about requirements on FQHCs from HRSA and FTCA. We'll then review HIPAA compliance and cybersecurity compliance and how that affects all of our healthcare organizations. And then we'll wrap up with CMS emergency preparedness requirements, OSHA compliance for medical and dental practices, and finally, we'll talk about MIPS compliance that affects medical practices, specifically not FQHCs. So moving forward, just to help you identify, I know I gave you a lot of content there of which requirements which regulatory compliance requirements we're going to cover today. And just to help you visualize here, identify which type of practice you are. If you're an FQHC, you can see along the top which regulations affect you and what you can expect to hear from us today. You know that all of them affect you except for MIPS, which doesn't affect FQHCs. If you're a medical office, a private practice, regardless if you're primary care or a specialist, most of the content and regulations we'll cover today affect you except for the HRSA compliance and the FTCA compliance that only affects FQHCs. And then we'll touch upon some great compliance for dentists that affects everybody as well, which is HIPAA, OSHA, and California state compliance. So just so you can identify which topics affect you. With that, I want you to understand, I'm sorry, I went ahead and covered that already about our format, and I'd like to introduce you to our presenters. So next, we will be handing off to our CEO and founder, Sunny Sharan. He has led several health IT initiatives, including Meaningful Use, PQRS, and HRSA, as well as MIPS and telehealth, and he cares deeply about simplifying compliance for healthcare practitioners. Next, we'll hear from Mike Moo, our Director of HIPAA Compliance, who has over 20 years of IT experience working with small businesses, as well as healthcare organizations. And he is lead on performing our security risk assessments and managing that process for us on our HIPAA compliance platform here. And then also, finally, we'll hear from Deepthi Rajaraman, who is our program manager for MIPS. She's a clinical provider and works directly with the other providers that do report data to CMS through our MIPS qualified registry, and has managed our MIPS qualified registry since 2016. So with that, I would like to hand over to Sunny Sharan.
Thank you, Kelly. Good afternoon, everyone. Thank you, CalHIPSO, for giving us the opportunity. Let me just request control. Yep. Let me see. Okay. I think
Bottom left. There you go.
Awesome. Okay. I'm going to be talking about two areas of compliance. One is navigating the fraud and abuse laws, which is applicable to all health centers. And then on topic 2, I'm going to talk about HRSA and FTCA compliance for FQHCs. As Kelly mentioned, the format's going to be, I'm going to talk about briefly touch upon what the compliance requirements are, risks of non-compliance, how you could meet with various tools out there, and then how you could use it. You could meet compliance through our compliance platform, HIPAA Watchdog. That's how I'm going to talk about it. Coming to the fraud and abuse laws, the enforcing agencies for fraud and abuse laws are CMS, Center for Medicare and Medicaid Services, and OIG. The fraud and abuse laws, there are 5 of them which are applicable to physicians. The risks of non-compliance are civil and monetary penalties. There'll be criminal penalties and exclusion from Medicare and Medicaid. And then there are several tools out there that are applicable for you to comply, that'll assist you to comply with. The 5 fraud and abuse laws are physician self-referral law, or commonly known as the Stark law, anti-kickback statute, the False Claim Act, the civil and monetary penalties law, and exclusion authorities. The top 3, physician self-referral, anti-kickback, and false claims law, define the specific violations of the fraud and abuse laws. Civil monetary penalties law and the exclusion authorities, the bottom 2, kind of define the fines that will be imposed or the penalties that will be imposed on any individuals or organizations that violate the abuse laws. So the physician self-referral law, or the Stark law, defines and limits physician referrals when there is a financial relationship with an entity. Under Stark law, referrals are limited to certain types of medical services, such as lab testing, hospital services, prescription services, and DME. Stark law applies only to relationships with physicians. Stark law, unlike anti-kickback statute, flatly prohibits a broad range of financial relationships and does not require proof of an intent to induce referrals, which is what makes it more complicated. So it doesn't require proof that an intent to violate a law is there. So Stark law can be very complicated to prove that you haven't violated it. The second one is an anti-kickback statute, which prohibits asking for or receiving anything of value to induce or reward referrals of federal healthcare program business. Examples of that can be getting cheap office spaces, patients referred to him or her, a free employee, a fat bonus, etc. So you could actually, any of those that you're receiving for value for referring federal healthcare business is a violation of an anti-kickback statute. The False Claims Act prohibits the submission of false or fraudulent claims to the government, which can be Medicare or Medicaid claims. And The civil and monetary penalties law define that there will be civil monetary penalties in addition to criminal penalties that can be imposed on physicians or organizations that violate the above thing. And finally, the exclusion authorities. The CMS and OIG have the authority to impose exclusions on providers. They can be mandatory exclusions or permissive exclusions, and this can be imposed on employees that violate these. This can be they can be imposed on contractors that violate these laws. So how do you comply? There's several ways of complying. First, meet a Stark Law exception, document financial relationships with referring physicians, have systems ready to ensure properly structured payments, watch out for lease creep problems, meaning if you're getting an office space from a hospital or from another entity, make sure that you don't get overboard incentives for having a free lease or something, and review productivity bonuses. Gifts can also implicate Stark Law. Anti-kickback statute compliance tips: use a safe harbor. It's a safe harbor, and then use fair market value for actual or necessary services. Most of these you can comply with by having adequate policies and procedures, and documenting financial relationships, and monitoring whom you do business with, which is checking for OIG and GSA exclusion checks for employees, vendors, and contractors on a monthly basis. OIG releases a list of excluded individuals and entity on a monthly basis. It is required for all healthcare organizations to check for these exclusions on a monthly basis and document them. So how could you meet them? On a free basis, you can download the list from OIG, and you could bump your employee list and vendor list on them. Or alternatively, you could use a tool, a compliance platform like HIPAA Watchdog, which automatically checks those OIG and SAM exclusions for you and sends you an alert and documents that these checks are made on a monthly basis. If you ever have to disclose this to OIG, or if you ever have to disclose it to a payer, or if you have to ever show proof of compliance, you always have all of this at one screenshot. So there are simplified compliance tools that are available. You don't have to download the list, do the Excel bumping, but you could do this by automating tools like this. So that completes my conversation on fraud and abuse laws. As a provider and as a provider organization, you must be familiar with this. Our intent was to kind of provide you with refresh this compliance requirements and make sure you're aware of what needs to be done, what are the tools out there. With that, I'll request Lauren to put a first poll out there. I have a poll question out to all the participants. The question 1 is, do you currently perform OIG exclusion checks for all your new hires and existing employees? You have 20 seconds to answer this. Okay. Lauren, you can close it. Lauren, can you also show the results? Are you ready? Thank you. So based on the responses, 38 of the poll respondents said they currently do. Several of them say no. Several of them say not applicable, unsure. So if you're unsure and if you're not doing it, this is something you need to kind of keep in mind. This is something you could do it. You could download the list from OIG. You can just Google it, OIG exclusion checks. You can find it. They will provide a list. You have to bump it with your employee list and a vendor list. You could also use simplified tools like HIPAA Watchdog to do that. So with that, you can close the poll out, Lauren. Thank you so much. So I'll then move on to my next topic, which is HRSA BPHC on-site visit compliance. This is applicable to all FQHCs and FQHC lookalikes. HRSA has a very well-defined compliance requirements. They have published their compliance manual, which identifies the compliance requirements in a 21-chapter brochure or a booklet. The consequences of failing to meet HRSA compliance can be they will place a failure to meet condition in their award designation, which will then follow a progressive action policy, and which may eventually lead to delays in getting funding or losing FQHC designation. On top of that, if you don't meet the HRSA requirements, FQHCs may lose their FTCA deeming, which may eventually, pose significant financial risks to an organization. There are several resources out there. Bureau of Primary Healthcare, HRSA publishes their compliance through their online portal. NAC and CPCA have conferences. They talk about compliances, and you could also meet on an operational basis the compliance through a platform like HIPAA Watchdog. I have identified the 21 chapters of compliance here, which talk about program eligibility, the oversight, the needs assessment, clinical staffing, and so on. However, for the sake of this webinar, I will touch upon 3 key areas of compliance under HRSA and FTCA. The 3 areas are clinical staffing, quality improvement and assurance, and FTCA deeming. Under clinical staffing, which is the key aspect is HRSA requires FQHCs to have qualified clinical staff seeing their patients, tending to the care of their patients. So that's the objective of this requirement, which is, if you define what it is, what they're expecting is the credentialing and privileging of all healthcare providers, licensed and other licensed providers, which is providers, mid-levels, medical assistants. There has to be an initial and recurring review, which is every 2 years, verify the credentials, which is are all the licenses active for the provider? Check the NPDB, National Practitioner Database, for all of this. So if it's an initial provider, do primary source verification, the education verification, all of that. Are there any criminal violations? Are there malpractice claims on this provider? Do that credentials. The second one is initial granting and renewal of privileges for clinical staff. Privileges include, is the provider fit for duty? Does he have their immunization checks done? Has he done his as the providers done their peer reviews? So these are required to be done. And the third thing is, not only you do it, but you need to maintain proper documentation of this on an ongoing basis. And finally, you apply the above 3: credentialing, privileging, documentation, to even to subcontractors. You have locums working for you, you have temps working for you. Make sure the credentialing is done for those participants as well. So that's the credentialing requirement that HRSA imposes. Some of them may also relate to private organizations that are involved in credentialing and privileges. Topic 2, moving on to HRSA, topic 2 is quality improvement. As Kelly mentioned earlier, an effective compliance program requires policies and procedures. So HRSA significantly poses emphasis on policies and procedures. So under the quality improvement requirement, HRSA recommends there has to be board-approved policies that establish a QI/QA program. There has to be a designated QI/QA manager or a program manager for the quality assurance. Then the third thing is, health centers should have operating procedures. The health center's physicians or other licensed professionals conduct QI/QA assessments at least quarterly. If you kind of recollect to what Kelly said, she talked about the effectiveness of a good compliance program. HRSA requires all of these for FQHCs. And health centers should have an electronic health record system. FQHCs should protect their PHI by, I'm sorry, that was my timer. FQHCs must protect their PHI by conducting a security risk assessment. And the third area under HRSA compliance is FTCA compliance. So FTCA stands for Federal Tort Claims Act. FQHCs receive their malpractice through FTCA, and in order to meet the compliance, they have to primarily do 3 things: the credentialing, privileging, and quality improvement, which I talked earlier, making sure all providers are credentialed. Second, documentation of all prior FTCA claims, make sure all the documentation is maintained. And then having a formal risk management program. In addition to a compliance, they're also asking for a risk management program. Under the risk management program, you need to have a training plan, which is like educating staff on all the risks, HIPAA, OSHA, emergency preparedness, and proper ways of conducting care, having a designated risk manager, and updating the board, the not-for-profit board, the FQHC board, with activities and goals for the year. HRSA requires all of this to be done and documented, which when you submit for FTCA deeming every year, you have to upload all of this documentation. Having all of this is essential for a HRSA compliance. Now, as I mentioned, the tools, HRSA provides significant amount of resources. You can get these resources through CPCA, NAC, and all of those conferences and the memberships. The other way, we could also use a compliance platform like HIPAA Watchdog, where you could do credentialing through our platform. You can do primary source verification, education verification. We're tied up with AMA, so your primary source verification is actually coming from AMA, American Medical Association, and education verification and background checks. You could do all of that through our platform. In addition, there's a risk management. You can do all the risk management assessment that HRSA recommends through our platform. In addition to staff training, HIPAA, OSHA, HRSA, FTCA, you could do all of those trainings from one platform. On top of that, you also have a centralized policies and procedure repository, which allows you to keep track of policies and procedures, also get board approvals and document them. So with that, I just want to highlight the difference. There are tools available. FQHCs, it's mandatory for FQHCs to manage their compliance. Our platform also provides a solution. I went slightly over my time, I apologize, but thank you very much for the opportunity. Kelly.
Thank you, Sunny. And Sunny went ahead and covered a couple areas of compliance for us. He covered OIG exclusion checks and fraud, waste, and abuse laws from CMS, and then covered HRSA and FTCA compliance for FQHCs. And with that, I would like to hand over to Mike Moo, our Director of HIPAA Compliance, to talk about HIPAA and cybersecurity compliance.
Thank you very much, Kelly. Lauren, can we go ahead and queue up poll number 3? First, I'd like to just get a little poll to see how confident you are in the effectiveness of your HIPAA and cybersecurity compliance. Now, we all know about HIPAA. We're all very familiar with it. I'm going to talk about some key things about it, mostly about the security rule. And if you have any question about it, it applies to everyone. I was just in a CMS webinar conference, and that was one of the questions that people had. Ooh, okay, 13% very confident, 50% confident enough, 31% slightly nervous. I'm going to have to agree with that statistic, and very afraid 6%. That I'd be really interested to talking to you guys later. All right, let's go ahead and close the poll, and let's go ahead and continue with the topic. Okay, let's double check. Great. Okay, so HIPAA compliance, what we're going to be focusing on, of course, is primarily the security rule, which is, of course, all about protecting health information, which is to say about the confidentiality, integrity, and availability of PHI. I'm going to refer back to this again, the CIA, just remember that. There are about 18 different identifiers in there that you have to protect. And here they are. I get some questions about this sometimes, and I see some violations all the time, primarily through websites, and people don't understand when they're asking people to fill out certain forms and it's not protected a certain way. That actually collects IP address information and URLs into a certain log on the website, which really should be cleaned and wiped out periodically. So we'll talk a little bit more about that in the cybersecurity portion. Now, what happens if you don't protect it? Okay, this is what happens. You could end up on a HIPAA wall of shame. Now, I recorded this just yesterday. This is from the OCR breach portal of active investigations. You can Google this yourself, HIPAA wall of shame. There are literally hundreds of thousands and millions of breaches reported in June and July alone. Now, a lot of these don't necessarily make the headlines. And, the investigation will happen eventually because they are, of course, backlogged. I mean, just look at this alone from recently, from emails, network servers, and also paper that got stolen or breached. Okay. So let's talk about some penalties for noncompliance, right? So this is for people that are, people that are very afraid about their program right now. You probably understand this. These are some of the quantifiable penalties. Okay, they start at $100 per record or incident and up to $50,000 each. I can't imagine many of those people from the previous slide here can handle $50,000 per each of these incidents and records. Look at this alone from Northwood Incorporated, which is, of course, a business associate, right? Business associates from the omnibus rule are completely responsible as well for that. But you, as covered entities, could get dragged down as well because of your association with them and that you trusted their records. Okay, now there's no upper limit to these. So, you know, there's really, the sky is the limit. I'm going to talk about the biggest case in recent history soon. And of course, you face possible criminal charges and jail charges. This could get pretty serious. So if you didn't know about it and it happened, you didn't know you were supposed to do certain things about it because you didn't do certain things that are required under HIPAA, such as doing a security risk analysis, you can get up to 1 year in prison. If you do it under false pretenses, up to 5 years. And of course, if you do it maliciously or for personal gain, you get up to 10 years. Okay. Now, this is all just guidance. I've seen cases go either way. All right. Now, let's take a look at just the overall. I mean, it just gets pretty bleak, doesn't it? Look at this. Now, IBM did a 2018 cost of data breach report. If you take a look at the chart right there, what's completely standing out, of course, is healthcare. We are the highest per capita cost by industry sector. It used to be, I think just 2 years ago, it was only 367 per capita. Now it's up to 408. These are just going to keep increasing. Okay, you have to do things. You have to do things about it. And that's just on the government side. Now, let's talk about the biggest breach, right? Recently, the biggest fine, the largest single settlement by the Office of Civil Rights, which of course is in charge of enforcing HIPAA. $16 million in a settlement because of 78.8 million records that were breached in 2014 and 2015, then followed by a $115 million class action lawsuit, and not to mention legal fees. Now, what can you do about this? Well, the first point you really need to do is do a comprehensive security risk analysis. And I'm talking about as comprehensive as you've ever done before. Always, every succeeding year that you do these, you have to look at different areas. You can't keep looking at the same standards because they're always changing. You have to improve. You have to document it. The Office of Civil Rights recognizes that this is the absolute #1 failure point that covered entities and business associates have. Okay, now the biggest challenge, of course, is that you're not setting aside enough time and resources to do them and not doing them properly and making it part of your regular process. Because it's not just one person, it's not just one department, it's really all departments. The leadership, directors, they have to all get involved in some point under the guidance of a requirement of assigning a chief privacy officer that oversees the whole program. Okay, so in many cases where these breaches were happening, it's simply because they weren't doing these and not covering up the holes that they found. All right, so make sure you do a full PHI audit. And finally, if you think you're doing everything, get a third-party review. Okay, get a consultant, get a company. Obviously, we're happy to do that with you. And make sure that you remember this is an ongoing process. This never ends. It's not a once-in-a-year thing. It's not once every time you have to submit MIPS or any of the requirements. Okay, you should be doing this regularly. The stakes are really high. Now, here are some resources that you can check out if you do want to try to see if you're doing things appropriately. Of course, you have the Health and Human Services website, which has some rich information that comes directly from the source. So you can definitely get all those guidances over there at hhs.gov and healthit.gov. And then finally, NIST has a great security framework. In case you haven't chosen one yet, you should. This is National Institutes of Standards and Technologies. And of course, I'm a little bit biased since I am the director of HIPAA compliance here at HIPAA Watchdog. We'd be happy to help you out with. Okay, we got simplified HIPAA compliance. We have the policies and procedures you should be using. We have a cybersecurity module to double check to make sure your IT infrastructure is up to snuff. We have training management, which is extremely key in a lot of preventing a lot of these breaches. We provide background checks, and of course, it's expert led. All right, now we're going to talk a little bit about cybersecurity. The regulation behind this, of course, cybersecurity affects everyone, but the regulation behind this, of course, is through the HIPAA and HITECH Act. Healthcare providers and business associates, you do have to make sure that you protect the confidentiality, integrity, and availability of PHI. And of course, the high-tech enforcement interim rule also comes into play. Now, again, it's all about the confidentiality, integrity, and availability. And tying that back into healthcare, we can't do healthcare unless the patients trust us. How can they trust you unless you're protecting their information? Now, I showed you some of the penalties from the HITECH Act for non-compliance, but there's some good news in the form of reduction for this year anyway. Now, look at the penalty tiers, 1 through 4. 1 is the least amount, of course, where you didn't have any knowledge. You said you didn't know. The maximum penalty is now no longer $1.5 million. It's now down to $25,000. So, you know, keep in mind that this is probably the only really great news I have for you. Reasonable cause is down from 1.5 million to 100,000. And willful neglect, where you actually do make sure you do the corrective action taken, is now down to 250,000. Okay. Willful neglect, no corrective action taken is still at 1.5 million. They do want to make a point, right? Now, next, let's take a look at the cybersecurity incident that affected Anthem. And pretty much it started with one email. That's all it took, one phishing email. Now, what's a phishing email? Real briefly, it's a spam email disguised to trick users to provide personal information on a website. Okay, so there are different categories: spear phishing, well phishing, clone phishing. We won't delve too deep into that. Just know that it was pretty much an email that tricked one person that then infected a bunch of people. All right, so here's the visual illustration of what happened. On February 18, 2014, a phishing email got sent and received. That user opened it, seeing that it was from WellPoint, which of course was Anthem Blue Cross's website. Now, here's the interesting thing here. If with the proper training, they would have noticed a couple of different things, probably an email, which I don't have access to. But that WellPoint, this is WE11, POINT. That is a completely fake and impersonated website that looks like WellPoint if you aren't looking closely at the email. So what happens is they open the email, which then launched a download of a bunch of bad files to the user's computers. And then over a period of months, that allowed the hackers to gain remote access to that computer alone and access to a bunch of other ones within the Anthem enterprise. So eventually they got access to the gold pot, which was Anthem's data warehouse, where they were able to exfiltrate 78.8 million unique records. They rounded it up to 80 million. The exact number is not completely known, but roughly 80 million records. So if you look at where all this started, it could have been prevented by a number of measures. And in fact, Anthem is reportedly spending, think about this number now, $260,000,000 US dollars in security related measures. So that's $260 million. All right. Here's the thing. That's not going to stop everything, I guarantee it. So besides spending money and resources in IT, of course, you can try to handle things on your own level. Okay, we're not all as big as Anthem. At least I don't think any of us are, right? But we can do some things. And one of the first thing is to remember that the human factor is the weakest link in data protection. Okay, you are definitely the first line of defense. IT might have prevented 99.9% of all those phishing emails that came through on the network, but it just took one to get through. That's really all it takes. Okay. Now, the reason why the fines became so high was that not only did that get through, there were a lot of other administrative, technical, and physical safeguards that they were not keeping track of in terms of the best policies and practices. Okay. But remember this, you are definitely the first line of defense. It's definitely your responsibility. In my opinion, you know, earlier on that poll, when I asked how confident you are about the effectiveness of HIPAA and cybersecurity compliance, I think the 6% that says they're very afraid are the people that know. They're the ones that are aware. I want you to be aware that this is the case. Okay, my goal here in HIPAA Watchdog is such that when I go on and do a site visit the first time, I might be scared. I might be like, look, you're not following the proper HIPAA practices. I see your cybersecurity is not up to snuff. If someone wasn't looking, I could easily access this computer, plug something in, and I could have compromised that system. I want it to be such that in the years following, when we're helping you, if I come back and I do another audit, that I'd be comfortable sending my friends and family there, or myself even. Okay. All right. So here's some cybersecurity resources that I recommend. These are all completely free. U.S. Department of Homeland Security has some great training resources. They're interactive. You can send these out as security reminders, all key to help people be a little bit more aware. SANS.org is a source for info security, training, certification, research. Love that site. Internet Storm Center is good just to see how the cyber attacks are happening worldwide. So it's a warning service to everyone. They give you a warning level. Krebs on Security is great because they cover it's a journalist that does a lot of detailed security coverage about security and cybercrime to see how things are happening, how they're doing it. PrivacyRights.org provides direct one-on-one assistance, original education publications. Have I Been Pwned? If you've never heard of this, you should go look at that right now. Just type in your email, see which sites have your data, and it has a database of all the public breaches, and it'll let you know if your information's been breached. And then finally, there's StaySafeOnline.org. It's National Cybersecurity Alliance and education for internet safety and security. Now over here, of course, in HIPAA Watchdog, we can help you with a number of these things. I briefly mentioned this earlier. We provide a third-party security audit. We can do external penetration testing, which is great to do every quarter or more often. We can do internal security checks to let you know, hey, what happens if someone does get in on a computer? What kind of habit can they reach? Where are your vulnerabilities? Let's plug them up. And then, of course, we have cybersecurity training, which includes a lot of the basic training that everyone should be taking. And of course, phishing awareness training, which might have prevented the Anthem breach, or at least delayed it quite a bit. And of course, we've got security reminders and notices. Okay, so that's it for now. Thank you very much for spending these past 10 minutes with me. Let's go back to you, Kelly.
Thanks so much, Mike. Mike covered some great info on HIPAA security requirements and how they affect all of our health centers, as well as some cybersecurity compliance measures that we can implement to protect ourselves. And with that, I'm going to go ahead and hand back over to Deepthi Rajaraman to talk to us more about MIPS compliance and how that affects private practices of all sizes, regardless if they're primary care or specialists. And she's also going to talk to us about OSHA requirements for training and also emergency preparedness. So Deepthi?
All right, so in interest of time, I am going to jump right into my first topic. So I'm going to get started with MIPS, of course, the Merit-Based Incentive Program. So CMS is the entity that implements the Quality Payment Program. And the goal of this program is to reward providers for the quality of service provided. And there are two pathways to participate in QPP. You can do it through the Advanced Alternative Payment Model or the Merit-Based Incentive Program, which is otherwise called MIPS. Now, who it affects? So I wanted to list all the providers as listed on the QPP website because CMS has changed the eligibility requirements and the types of providers who qualify to submit MIPS data over the years. So like, for example, you see psychologists, audiologists, and even registered dietitians are all new additions, to mention a few. So if you are a healthcare facility that does have any of these providers, it's important to check their qualification status. I want to stress here that ultimately it's the responsibility of the qualifying physician or the provider to make sure that somebody submits information on their behalf, if not themselves. It can be the organization you work for or the APM, whichever pathway you choose to submit information to CMS. If you're a qualifying provider, it is your responsibility to make sure that somebody is submitting information on your behalf, if not yourself. Now, the following bullet point lists all the criteria that CMS uses to pick you as a qualifying provider. So you have to qualify under each and all of these criteria in order to qualify. That said, the best way to check your participation status for MIP submission every year is on the QPP website itself. So you can just hop on the website. I have listed the link there as well. So you can just click on that for ease and make sure that you check your qualification status and determine this every year, because every year it might change depending on whether you qualify or not and the criteria that is used. Now in this next slide, I'm going to talk a little bit about QPP and the merit-based incentive payment system journey through the years, as well as what it means to not be compliant with the MIPS program. So till 2016, many of you may have heard of or may be familiar with the term PQRS. In 2017, what happened was CMS absolved the PQRS program within MIPS, along with the additional categories that it involved. So now there are 3 categories of information providers use to submit under quality, promoting interoperability, and improvement activities. And like Mike mentioned, HIPAA SRA, or the security risk analysis, is part of the promoting interoperability criteria. So there's a lot of information that CMS is requesting through the MIPS program. So you have to be aware of all the information you're required to submit as well. And they will score you on 4 categories, which would include cost as well. Now, CMS started with very minimum participation requirements. Like for 2017, they just needed 3 points worth of data, but it has proceeded to change through the years. And currently, a qualifying provider has to submit 30 points worth of data in order to avoid a 7% negative payment adjustment. Remember that if you do not submit any data as a qualifying provider, you will be hit with 7% a negative payment adjustment. On the plus side, if you do score a good score on 100, you are eligible for a positive payment adjustment. So anything above 30, may give you a modest positive payment adjustment as well. Now, my main takeaway bullet from this slide is that MIPS is here to stay. So as it stands today, the negative payment adjustment is expected to increase to 9% for 2020. So it is important for you to check your participation status every year. I've known providers who don't qualify, who did qualify and then did not qualify. So it changes every year. So check your participation status every year to make sure if you do qualify or not, and if you do know who is submitting information on your behalf. Now, on the next slide, I'm going to talk a little bit about what it involves. So yes, you are a qualifying provider. So then what do you do? Most of you may know this already. So you have to obviously track and implement a workflow on your EHR, know how to meet the measures that you have picked. And then you have to have supporting documents in place if you're submitting through registry and things like that. So you have to have your BAAs, you have to have your reports, patient charts, whatever supporting documents it requires. And of course, there are many ways of submitting this data. You can do this through a qualified registry. You can do it through QCDR. Your EHR vendor might be doing it. But remember that the CMS website is a very good tool to submit data yourself, and it has plenty of resources as well. So it starts in the beginning of the year when you start tracking, and then the following year, March, is when you'll submit your data. Of course, your life is never easy that way, so it does not stop there. Then you have to review your documents, and then of course remember that your data will go on Physician Compare for Medicare patients to have access to. And of course, you have to stay ready for audits all the time. But that said, I want you to remember that there are plenty of resources. Like I said, CMS is a wonderful resource for all the free, resources that you have. You can upload data, but then you also have qualified registries like ourselves who have to maintain status by staying compliant with CMS rules. And we help you, upload data, get immediate feedback based on your previous year's benchmarks. And then we help you track data, and then that way you know where you stand on each of those measures. Can you improve your score, and make sure that you do and submit the best measures that is applicable to you. So you also get regular updates, which I found very useful because you have to complete so many things under MIPS, under so many different categories. So regular updates, deadlines, and help to stay and adjustment. remember, if you're part of an advanced state, information on you will be eligible for automatic 5% adjustment as well. All right, let's move on to the next slide.
If you just check your audio for us real quick, you're having some audio issues a little bit.
All right, can you hear me now?
Yeah, you sound good. Great, thanks so much.
I'm able to advance my slides, so here we go. All right, okay, got it. So I also wanted to mention that there are resources. Like I said, CMS has plenty of free resources. Check your qualification status. Make sure you have a HARP account. You register with a HARP account to review your score, your payment adjustments, so on and so forth. And of course, you have resources like us, ourselves, who are qualified registries. All right, moving on to OSHA. So Occupational Safety and Health Administration sets and enforces standards that address potential workplace hazards. As a part of Department of Labor, OSHA promotes a safe and healthy workplace for employees all over the United States. Of course, we will concentrate a little bit more on medical and dental offices. Now, I wanted to list the various hazards that are applicable to specific healthcare facilities. Specifically, dental and medical and dental affairs labs are usually or routinely exposed to body fluids. So therefore, bloodborne pathogens are specifically relevant to them. So your staff might know what to do, but is it actually being followed? Are the rules in place? Do they know exactly what to do in case of an exposure, and things like that would be essential for this. Also, if you have all the precautions in place, then of course you're in the clear. But what if you're not? So where do you start? You can start firstly by putting up the OSHA 3165 poster in a conspicuous location. And then I think we're keeping up with the same pattern here. So make sure that you have a policy and procedure in place in case of an exposure and accident. And then make sure that you train your employees. Of course, that's important. And use precautions to avoid hazards. And if there is an exposure, do you know what to do? Do you have a corrective action plan? And can you manage consequences? I think that's where you should focus your attention as well. This is just a small screenshot of from the OSHA webpage itself to show you what is at stake and what are the penalties like if for a willful and repeated or serious violation of OSHA standards. All right, let's go ahead and again, like I've been telling you, there are a lot of free resources both on the OSHA website and of course helpful tools like HIPAA Watchdog that will get you started and stay compliant with OSHA standards. We provide training. We'll make sure you can build a policy and procedure according to the healthcare facility that you work at and make sure that you stay compliant. All right. So the last topic for today is the emergency preparedness and disaster recovery. So obviously in the wake of all the earthquakes in California and other things happening in other states, it's important to remember that there is a final rule published by CMS that was finalized in 2016. And the final rule for emergency preparedness requirements for Medicare and Medicaid affects all 17 providers and supplier types eligible for participation in Medicare. And if you're not compliant with these regulations, then you cannot participate in the program, and it's important to recognize that. And then also CMS suggests phases of comprehensive management to stay prepared. And this is almost a repetition. So make sure you know what the problem is and you know what to do and how to take care of the problem. Are you prepared in case of, if there is a pending emergency or a disaster that's about to happen, or do you know a response? Do you have a response plan and recovery in place? So remember that always helpful tools, just like HIPAA Watchdog, we can make sure that you can stay compliant by developing a policy and procedure, making sure that your employees are all trained annually as per compliance. And it's always, everybody may know how to react, but it's very important to reiterate it and train the employees, because you're not just responsible for the employees, and you will have patients and they should know what to do in the healthcare facility when there's an emergency situation. And And of course, there are plenty of resources divided and classified by healthcare facility, and they're very specific to those. Of course, HIPAA Watchdog is a great resource for you to get started with your emergency preparedness as well. With that, I think we're really running short of time, so I'm going to send it back to Kelly.
Thanks so much, Deepthi. I appreciate you. And thank you so much to everybody for your time and attention here today. I'm just going to wrap up by reminding everybody of all of the requirements and regulations that we reviewed today, and talk to you a little bit more, remind us that we are trying to be on the side of proactive rather than reactive or ignorant to the requirements that affect us all, regardless of the size of our organization or the complexity of our organization. We do realize we all share the responsibility of putting together a comprehensive and effective compliance program. And just a quick summary reminding us which regulations do affect each of us. And just a quick summary again of this, knowing that if we put together an effective compliance program by having written policies and procedures, identifying a compliance officer, properly training our staff, making sure that everybody feels open and able to identify risks and communicate them. And then checking on ourselves, monitoring ourselves, auditing ourselves, using external auditors to check ourselves, using resources available to perform risk assessments and be able to report on those findings. And then enforce our standards and make sure that we document our corrective action plans. These are just a quick reminder as to what we really could implement if we plan ahead. And just a reminder that, here at HIPAA Watchdog, I know you've heard it 100 times, we help you track and report on all areas of compliance, regardless of your size. We do support solo providers in completing their annual security risk assessments for HIPAA, just to be compliant for meaningful use or MIPS, whichever program they're participating in. And they use our HR portal to track their few credentialed staff and train their staff. But larger health centers and FQHCs, primary care associations, they use us for training on a larger module and managing their risks. So just wanted to make sure you do know that there are centralized compliance tools available to you and that we're here to inform and support you. And with that, our presentation is wrapped up. We thank you for your time and sharing your lunch with us. And we are here as a resource to you, and we'll stay on the line as long as we can. Lauren, I'll go ahead and hand it back over to you to take any questions that come in. We're here to support any questions on any regulations or compliance issues at all.
All right, thank you, Kelly. And this is David Ford again, just to wrap up this. As you noted, this is usually the time in the webinar when we would do Q&A using the question box. Since the presentation ran very up to the line, we're not going to have a lot of time for that, but I will throw this one out there. We always get one question without fail at every webinar we do. It's always our most popular question, which is, will the slides be available after the webinar? So I will say from the CalHIPSO side, the recording of the webinar will go on the CalHIPSO YouTube channel. If you go on YouTube and search for CalHIPSO webinar, you can find our channel. We put the recordings of all of our presentations up on that channel. We also link them to the CalHIPSO website, www.calhipso.org. And if you would like further follow-up, you're welcome to email us at info@calhipso.org, and we're happy to follow up with you one by one. As far as the slides, I'm hesitating a little bit because just from the HIPAA Watchdog folks, we didn't really talk about that ahead of time. But does one of you want to say, like, are you okay with these being sent out?
Of course, please, by all means.
Okay, so email, if you want the slides, email CalHIPSO at info@calhipso.org and we will get you a copy of it. And with that, we are right up against time, so I will thank everyone for your time. Thank you to the Sunny and your team. You guys have been fantastic presenters, and you've always been great friends with CalHIPSO, so look forward to talking to you more in the future. Thank you, everyone.
Thank you.
Thank you very much. Thank you.
Yes.